Welcome to the Tweedy & Associates Equine Veterinary Services online series on radiographs of the horse. In the first of our series, we're going to look at the radiographs of the carpus and trying to explain the anatomy of the carpus as we see it as veterinary surgeons. So, the carpus, as known in veterinary terms, is sometimes referred to as the knee in the horse. It's on the front leg, and you'll see here it's a joint that takes a large amount of force when a horse is galloping. The knee is not designed to bend backwards, some referred to as hyperextension, but during high speed work, galloping and jumping, you'll often see slow motion images where the knee bends quite far back behind the vertical. This places a lot of force on the front of the joint, so this is the most common site we see for injuries. The carpus is made up of three joints. So, we have the radiocarpal joint, the middle carpal joint, and the carpal metacarpal joint. The radiocarpal joint consists of the radius and then the proximal row of carpal bones, with the middle carpal joint in the middle, and then the carpal metacarpal joint made up with bones of the knee and the cannon bone. As we can see on this x-ray, this is the first x-ray we usually take at Tweedy & Associates, and this is called a DP. This is taken from in front of the knee, and you can see here we see the splint bones, the cannon bone, and the other splint bone. Next view we take is the dorsolateral palmar-medial oblique. This is taken at 45 degrees across the front of the knee to try and highlight the radiocarpal bone, the edge of the radiocarpal bone here, which is a common site for injuries. This is also the third carpal bone here, and we have the radius again. At the back here we see the accessory carpal bone. The next view we take is the dorsomedial palmar lateral view, and this is again an oblique view taken to highlight the end of the radius and the edge of the intermediate carpal bone. Also, we see the accessory carpal bone in full view here, so any fractures in this site we can easily see on this view. Our next view is the flexolateral view. This allows us to open up the joint space and see the edge of bones a little bit easier. So we can see the edge of the radius with no other bones close by, and also the intermediate carpal bone and the radiocarpal bone. And the final view we take at Tweedy & Associates is the skyline view of the third carpal bone. The third carpal bone is one of the main bones in the knee that takes a lot of weight-bearing surface and is involved in articulation in the middle carpal joint. We look to see the surface of the bone, and if we have injuries, which you'll see in a later video, you can often have fracture lines running in from here or across the front. And equally as well, we look for the bone density pattern, and if there's abnormalities in that, then often we will describe that as third carpal bone sclerosis. Well, thank you very much for listening to this very short video. If you require any more information, please feel free to visit our website at www.tevs.com.au, or you can give our clinic a ring and organise an appointment if you have a horse that you think has a lameness issue and you'd like one of our vets to have a chat to you about it. Please feel free to give us a ring. Thank you very much.